Mayo Clinic offered an update on COVID-19 and the Delta variant today, touching on issues from who is most at risk to what impact the virus may have when kids return to school. KIMT News 3's Jessica bringing you joining us live from downtown Rochester with what we can do now to prevent the spread of variants and what doctors want us to know. Jess?
Katie, Mayo Clinic says the combined effect of masking and vaccination does more to reduce the transmission of COVID-19 than any one measure alone. And as the CDC has been recommending, anyone, regardless of vaccination status, should mask up in high transmission areas. The U.S. is now averaging more than 100,000 new COVID-19 cases a day.
As we look to the next few weeks here, the Delta variant surge is far from behind us and is likely to continue to accelerate, particularly in communities with lower rates of vaccination.
The uptick comes as thousands of unvaccinated children return to school.
The school year starting is happening at an unfortunate time relative to this Delta wave right now. And schools across the country are having to grapple with what is going to be the most effective way to try to mitigate the risk for in-person learning.
Mayo Clinic says there's not a specific timeline for when vaccines will be available for children under the age of 12, which is why it's important to get vaccinated if you can to protect the most vulnerable.
This is really a higher risk for unvaccinated individuals, and children are one of our largest pools of unvaccinated persons.
The healthcare giant also says the fastest way to ensure another COVID-19 variant doesn't emerge is to get as many people vaccinated as possible.
The more people get vaccinated, the fewer opportunities there will be for a mutation to develop into a new variant. So enough people getting vaccinated isn't going to select for these variants, new variants to develop. It'll actually suppress the opportunities that they have to develop.
Mayo Clinic also touched on breakthrough COVID cases. That's when someone who is vaccinated contracts COVID-19. Health officials say a majority of those cases show reduced complications, if symptoms at all, and proves the efficacy of the vaccine in preventing severe infections. Live in Rochester, Jessica Bringy, KIMT News 3.
Thanks, Jess. Mayo Clinic also saying it's likely COVID-19 will be around in some form for the foreseeable future, will likely require a yearly vaccination like the flu shot.